start a senior care business with no healthcare experience? One of the biggest reasons women talk themselves out of a senior care business sounds very logical. They say, I'm not a nurse. I don't have healthcare experience. I don't even have business experience. And if you've thought that, I want you to stay with me because belief stops more capable women than anything else. And here's the truth. Most people don't understand about senior care businesses. You do not provide the care. You run and build the business. The distinction changes everything. As the owner, your role is to hire qualified professionals, set the standards, build the systems, and support the families. The actual care is delivered by trained caregivers and nurses who already have the skills. This is not a clinical role. It's a leadership role. I know this firsthand because I started with zero healthcare and business experience. None. Yet, my company has now helped thousands of families, operated for 10 years, and generated millions of dollars in revenue. How? Because I didn't try to be the caregiver. I focused on building strong systems and hiring the right team. There is an easy way to hire all the talent you need for your business. We started hiring before we even had our first client in place, so we were ready. We still have staff working with us who were with us in our first hiring wave in 2016. There are ways to hire, manage, and reward your team, and they are all easy, repeatable steps. I've also watched women with extensive healthcare backgrounds run a successful senior care business because they did understand the care side, but that isn't in any way required. Let me tell you quickly about my client Leah. She's a single mom with young children, and she wanted to be her own boss, but she was frustrated and wasn't confident she could start her own business. Here's what she said after working with me. Working with Vicky has been an amazing experience. The time we spent being coached by Vicky helped me pull together the most effective tools, plus taught me other things that I felt have been missing. I feel very fortunate. Had I not worked with Vicky, I might still be mucking through my personal toolkit, not knowing what to use or feeling confident that using it would make a difference. I don't tell you that testimonial to impress you, but to impress upon you that if you have a desire to work for yourself, to make a difference, and to create a business that helps others, it's just a simple series of steps repeated every week, and I can teach you those. If this misconception of having to have healthcare and business experience has been holding you back, I host a free class where I explain the why now is the best time to start a senior care business very clearly, so you can see if this business is actually for you. The link is below. Now, you might also be wondering, is it too late for me to start a senior care business in midlife? Let me guess, you're not 25. Maybe you've already had a career, and maybe somewhere in the back of your mind you're thinking, did I miss my window? Is it too late to start something new? I asked myself the very same question when I started my senior care business at 45 years old. Senior care is one business model where age and life experience are an advantage. Families aren't looking for hype. They're looking for compassion, certainty, maturity, clear communication, and trust. This is not a hustle business. It's a leadership business. And leadership gets stronger with age. I started this business after being laid off twice and caring for my mom with Alzheimer's and dementia. I had worked 20 years in the environmental sector, dedicated myself to professional development, advanced in leadership roles, and salary had risen over the course of my career, and none of that mattered when my employer no longer needed my position. I wasn't early, and I wasn't ready. And let me tell you about Laura. She had homeschooled her kids, and when her youngest graduated high school, she found herself still wanting to help others. She wanted to run her own business and tried to figure out how to do it on her own before she found me. Working with me brought a simple, repeatable system that virtually guarantees success. Plus, Laura worked with me directly to ensure she knew exactly what steps to take, week in and week out. And many of the women in the senior care businesses are in their 40s, 50s, and even 60s. And they build incredibly strong businesses because they take this seriously. They're not chasing trends. They're building stability. So if you're questioning whether this stage of life is a disadvantage, I walk through exactly why it's the opposite in my free class. The link below is available if you want clarity instead of guessing. And finally, why should you learn how to start a senior care business from me? Here's the question more people should ask, but rarely do. Why should I learn how to start a senior care business from you? It's a fair question, and today I want to ask it directly. There is a difference between someone who talks about senior care and someone who has built, scaled, and operated a senior care business through real challenges. And there's another difference between owning a business and knowing how to teach someone else to build one. I do both. I've started from zero, operated inside a franchise, left the franchise system, built my business up independently, survived the pandemic, run my business entirely remotely, and I have every system documented along the way. I didn't just succeed. I paid attention to why things worked and why they didn't. That's what I teach. If you want to understand how I teach this, not just what I've built, I host a free class where I walk through the business model and my approach step by step. The link is below. There's no pressure, just clarity. I'm excited to work with you and I look forward to seeing you soon.